Yeah, we will continue on nephrology. Cardiogenic shock will cause tubular necrosis usually. Proteinuria, hematuria after 24 hours of sore throat. This is possibly due to IgA nephropathy. Uremia will cause fibrinous pericardial effusion. Differentiation between acute and chronic renal failure will be with abdominal ultrasound. Membranous nephropathy, male to female ratio is 2 to 1. Diet rich in potassium is tomato and also banana. Association with membranous nephropathy include SLE, gold, penicillamine, non-steroidal, hepatitis B, hepatitis B virus, syphilis, malaria, leprosy, schistosomiasis, non-Hodgkin lymphoma, leukemia, melanoma, and carcinoma. Asymmetrical kidney with hypertension and renal impairment, this suggests renovascular disease. Adult polycystic kidney disease, it occurs when in 1,000 Caucasian. We have two types. Type 1, 85% of cases, in which the defect in chromosome 16. Type 2, the defect in chromosome 4. Screening tool is ultrasound. We can confirm the diagnosis by finding two cysts, unilateral or bilateral, in people aged less than 30, and two cysts bilaterally in people aged from 30 to 59. Bartter syndrome is autosomal recessive disorder. It is characterized by extraglomerular hyperplasia, hyperaldosteronism, hypokalemia, hypochloremic alkalosis, and hypercalciuria. Gentleman syndrome has similar features to Bartter syndrome, but the difference is that Gentleman is more common than Bartter, and also it will present later in life, and it could be associated with prolonged QT. Liddle syndrome also has similar features regarding this hypokalemia and hypochloremic alkalosis, but it doesn't consist of hyperaldosteronism. Renal angiomyolipomata bilateral, this will be found in tuberous sclerosis, which is autosomal dominant disease, has cutaneous features and miscellaneous and neurological. So the cutaneous features are ash leaf, which is depigmented spots, shagreen patch, this is roughening in the back or the spine, adenoma sebacum, subangular fibroma, and cave olet. Neurological features, epilepsy, intellectual impairment, and developmental delay. Other manifestations, it will include heart, lung, kidney, brain, retina, we will take it individually, heart, rhabdomyoma. Lung multiple cyst, this will be due to lymphangiomyomatosis. Lymphangiomyomatosis. Kidney they will have polycystic kidney disease and angiomyolipomata. They will have gliomatous change in brain, and they will have retinal hematoma or phacomata. Regarding donation, the living related donation in inherited renal disease, it is better. We can take from sibling, because especially in, as we said before, in polycystic kidney disease, we need them to be aged more than 20. So 90% will be confident, if ultrasound is normal, that they are not having the disease. But also the patient can wait for unrelated donor. Micturating cystogram is a diagnostic tool for vesicular-ureteric reflux in children. We can use also retrograde byelograph for ureteric lesion, which we saw already in micturating cystogram. So micturating cystogram first, and then byelography. This diagnosis will be suggested by recurrent UTI and renal scarring, and also could be hypertension. Pulmonary hemorrhage with rapidly progressive glomerulonephritis and antiglomerular basement membrane antibody against type 4 collagen. This is usually due to Goodbasher syndrome, and typically the complement will be normal. Low complement, it will be associated with SLE, cryoglobulinemia, and mesangiocapillary glomerulonephritis, post-streptococcal glomerulonephritis, and subacute bacterial endocarditis. So again, the causes of low complement in rheumatology, SLE, cryoglobulinemia, post-streptococcal glomerulonephritis, and subacute bacterial endocarditis. Transitional cell carcinoma of the bladder, male to female ratio 4:1. It is more common than the other malignancies of the urinary tract, like ureter and renal pelvis tumor. It will present with painless hematuria. Predisposing factors include smoking, phenacetin, cyclophosphamide, and also industrial carcinogens like in rubber industry. This predisposed to transitional cell carcinoma. But squamous cell carcinoma will be predisposed only by schistosomiasis. Albert syndrome, it is X-linked dominant in majority of cases, but we have a minority variant. There is rare autosomal dominant and 10% autosomal recessive. So the majority of cases is X-linked dominant, but still we have rare autosomal dominant and 10% autosomal recessive. The problem is that there is a defect in genome coding for type 4 collagen. It is more severe in males. It can present with failure after transplant due to formation of antiglomerular basement membrane, which will represent like Goodbasher syndrome. It will present with usually microscopic hematuria, progressive renal failure, bilateral sensorineural deafness, lentoconus, retinitis pigmentosa, and on microscopy we will see splitting of lamina densa. Rhabdomyolysis, it will present usually with collapse, acute renal failure. Typically, it will improve with IV fluid, which we are used to prevent deterioration in renal function. Also, urine alkalinization may be used. Causes could be for rhabdomyolysis, ecstasy, seizure, statin, McArdle syndrome, and crash injury. Again, regarding adult polycystic kidney disease, it can present with chronic loin pain. This is due to expansion of the kidneys.